Good morning, friends. Thank you to each and every one of you for being here with us today. I welcome you once again to your induction ceremony Ignite 2021. I'm Professor Arpit Trivedi, your event host, moderator, and voice. Let me take you through the process of how we will conduct the webinar today. Our guest will address the batch for 45 minutes, which will be a mix of knowledge sharing and question and answers. Students are encouraged to put relevant to the topic questions in the chat box. It gives me immense pleasure to welcome Ms.Pallavi Jain, Managing Director, Krishna Diagnostics Limited. Krishna Diagnostics Limited is India's largest diagnostic service provider, both in radiology and pathology. Krishna Diagnostics was established in the year 2011 with an aim to make quality diagnostic services accessible and affordable to the last mile patient, even in the remotest of locations. Presently, Krishna Diagnostics is a leading diagnostic company with the largest private-public partnership and is present in 14 states and 1,800 plus locations across the country. In the recent past, Krishna Diagnostics has attracted investments from major venture capitalists, including Kitara Capital, Somerset Capital in Series A, and Pi Capital in Series B. Ms. Jain has been associated with Krishna Diagnostics since its inception and has been instrumental in growing the company to present-day pan-India network. Now, I would request Madam to open the address for our 22nd batch. Over to you, Madam.
Good morning, everyone. And I firstly thank you all for inviting me for this amazing session today. And it is definitely going to be a great session, I know, because interacting with young minds who are the future of our country gives me a lot of happiness, because ultimately they are the ones who will be taking our country ahead. Without taking much time, I would like you to take you through the presentation. Usually I generally don't prefer presentations, but because we have students and they are all technology driven, they are the like minds and they are the next generation who are very comfortable with presentations and PPTs. So I'll take you through the presentation. You all are free to ask me any kind of questions and I will be more than happy to answer all the questions, whatever time permits. So I will run you through the presentation very quickly, because I prefer having a one-on-one interaction or question sessions more than spending time in presentations. You all know that the topic for today is opportunities in healthcare, job opportunities. You are the young minds and you are the ones who are going to join the various kind of industries. Now, when I say healthcare, a lot of people, especially in our country, we know that it is a social stigma that healthcare cannot be a business. This is exactly what even we know and we think about it. And that's the reason Krishna has been able to reach these kind of milestones, because the thought of having healthcare at an extremely attractive price is the base of the inception of the company. But definitely we all need bread and butter. We all we all run a family. We need income to take care of our lives, of our family, of our parents, and of course we'll be getting married, so children. So it's a whole journey altogether which we need to take care of, and for that money is an important factor. So how business can be done in the healthcare sector, how a job can be done in a healthcare sector. Equally making sure that there is a lot of empathy, care. At the same time, you're also earning. So it gives me a lot of happiness to say that in spite of our rates being almost 40 to 50% lower than our peers and lower than our competitors, we still have a EBITDA of 30%. So you can understand that there are great opportunities. And if you have a good business sense, you can definitely reach skies. So we always say that if you can imagine it, you can definitely achieve it. And if you can dream it, you can become it. So let's begin the session on this note. So we all know that healthcare is one of the largest sectors in our country, though government spend was very, very low in the healthcare sector. But COVID kind of, has shaken up everyone. And that's the reason various new opportunities, various new doors have opened for the healthcare sector. Government has started investing a lot in the healthcare sector. So it becomes a very positive sign for all of us. We can not only partner with the government, but there are various job opportunities in private as well as government sectors in this industry now. We definitely know that well-trained professionals are required for healthcare, but at the same time, we should not forget that there are various other verticals in the healthcare sector where even non-trained people also get a great opportunity. Cost competitive, India has always been extremely cost competitive compared to the other Asian and Western countries. We all know that Indian doctors, Indian healthcare professionals, Indian technicals, they have a great demand in other countries because here we actually have a hand-on experience on the ground because of the number of people, number of hospitals, and of course our population. So when all put together, we know that we get a very larger kind of exposure and experience. So these are the basic key segments in healthcare where job opportunities are available. There are hospital services, there are diagnostic services, there are medical device manufacturing companies, and most of the top companies of the world are now manufacturing in India. Also, they have various places in our country, including Bangalore, Visakhapatnam, and Goa, where all these kind of medical device factories have been set up. Where again, that's one opportunity. Pharmaceuticals is one vertical where there are a lot of job opportunities. Telemedicine, medical tourism, and tele radiology. These three verticals are relatively new compared to the old versions like of pharmaceuticals or hospital services. But these sectors are now booming because we all have experienced that during COVID, nobody wanted to step out of the house. And as I mentioned earlier, that technology is what we all love to explore, and we want everything at a click of a button. And there's where telemedicine and teleradiology is playing a very, very important role at the most rural location. With connecting through tele platforms, we can give services and we can give opportunities to multiple million people. And that is one sector which everybody should look at. Medical tourism, as I mentioned, that of course a lot of people trust Indian healthcare, and hence medical tourism is also blooming a lot in our country. So that also vertical can be looked upon at. I just spoke about it that yes, we are focusing a lot on digital health. There's artificial intelligence coming in. There is regenerative medicine. Now people have become more cautious about their health, and hence preventive health. Now, for example, now even if we have been a traditional company, but looking at the time, and we've always incorporated technology. We've always given importance to technology. And last year on our 10th anniversary, we launched the Krasna app, which is a very user-friendly app, wherein you download the app from the Play Store and you can book your, not only book your test or not only book your healthcare services, but at the same time, we have made a DigiLocker kind of thing in the app itself, wherein all your data, if you have done a test with Krasna Diagnostic in the last 6 months, all these reports will be available, which you can share it in the PDF format with any of your doctors or anywhere across the globe to get a second opinion, to get a treatment plan immediately done. So that has played a very important role. So this is all what I covered a couple of minutes back. So I'm not going to spend more time on this slide, that how healthcare has become more important. There are lifestyle changes, and hence there are many diseases. Of course, government has become more open now. One sector we all are looking at, which seems to be more attractive due to the lifestyle changes. Cancer has spread, and molecular diagnostics as well as genomics is one part where we are seeing that there is going to be a great scope ahead in healthcare. So career, values, and visions. So what are the careers in healthcare industry? So as I said, there are various verticals where all the young minds can look at it. It's not necessary you have to be a doctor or you have to be a technical person or you need to have a degree in medical to get into healthcare sector. There are various sectors where you can explore. Plus, you all are highly qualified individuals, and I more personally feel I mean I would like to thank the entire management to have invited me to speak, because undergraduate speaking on a platform where there are graduates and postgraduates, it's definitely an honor. But I would really like to tell you that if you have a will and if you have the ability to inculcate and to adapt all the things around you, you definitely can do whatever you wish to do. So hospital administration is one sector where your administrative skills, your MBA, that helps you a lot in becoming a good administrative. More and more, I personally feel that your public speaking and your relationship management needs to be worked on it, and then you definitely have a very great scope, because number of hospitals are increasing. We need a lot of analysts these days, because all the companies, all the larger companies, hospitals are now trying to get into the corporate kind of sector. The traditional hospitals are now fading away. A handful of hospitals still remain like hospitals, but most of the hospitals are now converting into a corporate style, because we all, when we enter a hospital, if the environment is good, if there's cleanliness, if there's everything systematic, we all like to go to such places and to analyze these kind of things, to understand what is the need of the time. There is a lot of things which are involved. There's data, there's research, there's financial management. So all this needs analysts, so you can always look at that sector. Of course, then there are healthcare consultants, creating awareness, and then collaborating with HNIs, collaborating with corporate companies, collaborating with various other sectors. In COVID, we saw that a lot of companies came forward to get their staff tested. A lot of societies approached us that we want to get our maids tested. So these are the sectors where you can become a consultant. Sales and marketing is open in each and every area. Here the difference is you need to interact day to day with doctors and with highly qualified professionals to ensure that how you are going to place your company wherever you join, and make them aware that how your company or where you're working is better than the peers, and getting them refer patients to your diagnostic company or hospital. A lot of projects are coming up. When I speak specifically about Krasna, Krasna is India's largest PPP healthcare service provider. We tie up with the government, and hence every year we have various projects to talk with. When I'm speaking to you, there is an entire team which is working in Punjab. The project which we recently won, where we have to establish 28 CT scan, 6 MRI, about 30 labs, and about 150 collection centers. So these kind of large projects are there. So so it is just overseeing the work. So a proper training is given for that. Each and every sector needs training and hand-holding, and any good company does that a proper hand-holding, on-site training, internal training, inductions, all these are given, and there is a hand-holding from time to time to ensure that we all are together to as a team, and we take it forward. So project manager is one sector. There are market research analysts. The same thing is applicable, as I told you before, that if you're doing a project in a particular sector, rural area, then you need to understand that how many people are there, what are your competitors, what are your rates, how many doctors are available in that area. So that's one research team which is needed. Health informatics and medical entrepreneur are another two sectors where opportunities can be looked at. Yeah, so this you can look at this slide, but I would like to put my view on this slide as a different on a different angle. Is anything you do in life, you need to have an ownership and accountability. Whether you do a job, whether you do a business, whether you just get into some social kind of activity, whatever in your life you do, you need to take the ownership and accountability for it, because you are responsible for your growth. You are responsible for what career you have chosen, and you are responsible on how you take your life ahead. What I have seen in youngsters these days, or what I have seen, is there's a lot of peer pressure, there's a lot of society pressure, and there's a lot of pressure on performing. I personally feel that all this should be kept aside, and happiness should be your top priority in life. That whatever you do, you are happy and you spread happiness. And when you have this kind of thought process in your mind, then you take the accountability. Then you know that what you're doing is giving you internal satisfaction. There has to be, and specifically when I talk about healthcare, there is a lot of care, empathy, and respect needed in this industry, because you all know that when a person comes to a healthcare sector, when a person comes to a diagnostic sector, specifically in diagnostic, he really doesn't know what's wrong with him, because all his tests are dependent. Entire treatment is dependent on what kind of results his tests come out. So he is actually disturbed. And then there, when you meet him with empathy, you take him by care, you counsel him, and you give him the comfort, his half of the pain is gone there itself. So that's really very, very important. Like Professor Neeraj told me a couple of minutes back, that when we saw the report of COVID negative, everything was so happy. And that's exactly what we wish, that people are healthy, but we know that the lifestyle changes have ruined our lifestyles. They have made and going forward, we see a lot of other diseases coming in. So it's very important that if you want to enter this sector, it is more of being a human being than being just a robot and just doing your job 9 to 5. Also, I would like to emphasize here is, healthcare is not a 9 to 5 job. There are emergencies you have to attend, patients are disturbed. So it cannot be like any other corporate job. You have to be available round the clock to ensure that your patients, your partners in this industry are comfortable. Professional ethics is one thing which definitely is needed in each and every sector, not only healthcare, but every sector. There are these ethics which are required. Punctuality and communication, as I said, every second counts in healthcare. A treatment or a diagnostics delayed is a treatment delayed, which again then leads to any kind of fatality or a casualty. So that is one thing. Always be a learner. Learn, unlearn, and relearn is what I have been doing. As I mentioned earlier, for me also, when I joined Krasna, I was completely raw. I came from a very different background where, I was in a corporate, different world where, there was glamour, glam, and there was, it was a 360-degree turn in my career. But what I did was I learned, I read a lot, and I understand what sector I'm getting into. So every person you meet in your life teaches you something. It depends on you that what you take from the person and what you leave. So this is one habit you should have, is whomever you meet or where you're going to meet, you should know whom you are going to interact with, what you're going to present. And mistakes is a part and parcel of life. Nobody is perfect. So I personally feel that, if there is no mistake, then, you are a robot. So if you do mistake, make sure that you don't repeat the mistake and you learn from the mistake and correct yourself. As I always said that, yes, I really, really adore the youth of our country. The way I see the young generation coming up with open mindsets, with a lot of opportunities. We see you all as leaders of tomorrow, and definitely wish that, our country sees a better future. We are in good hands already, but with young minds, with technology, with digitization, I'm sure we are seeing the again Sone ki Chidiya kind of days. So that's what my presentation was all about. I would like to open the floor for questions, and I would be more than happy to have a interaction with everyone, and that is more that gives me more happiness actually.
Madam, students have asked a couple of questions while you were presenting, so I have made a record of it, and I would be asking you one by one.
Sure.
Madam, the first question is, this is from a student of mine from MP. He asks, Madam, can you elaborate on how hospitals are changing when you refer to the corporate style?
So you are in MP, so I'm sure you are aware of Indore. So I'll give an example of Indore MY Hospital, which is one of a very traditional hospital, which is a very, very old hospital. but the number of footfall were very high. Government was not able to manage the crowd there. Services were not available on time, round the clock. Years when privatization took place, PPP tenders were floated. Now PPP tender is floated for the entire state. From the last 3 years, Krishna Diagnostic is present in MY Hospital, wherein we have made privatization, but the rates are of government. Facilities are available 24/7. There is manpower. So when it is a PPP partnership, the government becomes more relaxed because a corporate company comes into picture, which makes sure that the facilities are like any other corporate hospital. The services are available round the clock, and opportunities to a lot of people are open, so where they can definitely come in as a team and help out in day-to-day operations. The same is applicable with hospitals. Government has started taking cath labs. Government has started giving all the different departments on PPP mode. Also, when I talk about private hospitals which were small to 50 to 60 bedded hospitals, which were traditional nursing homes, they have now started revamping. There are a lot of schemes which the government has launched, like Ayushman Bharat, or there are Rogi Kalyan Samiti schemes. So for that, to make sure that scheme is allotted to the hospital, they have a certain guideline now. So if you go on any government page of the healthcare or National Health Mission page, you will definitely see the kind of requirement and SOPs they have laid, so that the hospital is able to deliver the right kind of services to people now.
Absolutely, madam. Very well said.
Yeah.
So, ma'am, this question is again from MP, but from Bhopal. My students want to know, madam, how did COVID-19 change your business model?
COVID-19, frankly speaking, as such, we've never considered as business. I'm talking about Krishna Diagnostics. I'm not talking about my peers or competitors. We are praying every day that COVID goes, because it has shaken up lives. It has taken lives of multiple people, and there's nothing more unfortunate than COVID. But yes, it has definitely made a very, very remarkable change in the healthcare industry in various forms. One is people have started now taking healthcare on priority. They have become cautious about their healthcare, which gives an opportunity that people have started opting for preventive healthcare checkups. People have started ensuring that their health insurances are in place. Second is it gave us an opportunity to internally grow ourselves in terms of employing more people. I feel extremely happy and proud to say that Krishna was the only company in our country where a lot of companies were removing resources due to the financial stress or anything. Krishna gave opportunity to more than 1 lakh people during the COVID times, whether it was data entry operators, whether it was phlebotomists, whether it was collection boys, whether it was logistic team to transport samples. So there are various sectors which are needed. That's why I said that healthcare, when you talk about healthcare, it's not important that you have to be a doctor only. You have to be a person who is willing to do any kind of work. I would like to give an example of 2-3 people. Like, I have a Rangoli artist who has been doing Rangoli for me for last 20 years now.
Okay.
When COVID hit, he had no work to do and he had a family to run. So he called me that, ma'am, I can do any kind of work, but please, I need work. He's a highly qualified person. It's not that he's not educated.
Okay.
He was teaching in Deccan College also, but everything got closed. I told him, I right now, because you are an educated person, I'm sure I can give you a opportunity. There was ICMR entry which was required. So every test had to be loaded on ICMR platform, and it was a very heavy task because Krishna was doing almost 10,000 tests per day.
Yes.
Loading that 10,000 data every day was a very huge task. So I said, I can give you that opportunity with a team of handful people. Can you do it? He did it, and trust me, even now, he does not want to leave Krishna. He's telling, I feel not only happy about doing the job, but I feel I'm giving back to the society I belong to. So, I always say कि अगर चाह है तो राह अपने आप निकल जाती है. So that's exactly what you should do.
Right, madam.
Yeah.
Right. Madam, my next question to you is again, it's on this. I would like your view. My student from Punjab has asked me, Madam, what is your take on the greed that has been always there in the medical profession?
I would like to correct one thing. People think there is greed, but there is not greed. Why I tell that? People always see the outer picture. People do not know what the real struggle is behind. What are the kind of challenges we face every day? Definitely, when it comes to, see, there are two different sectors we are talking about. Hospital industry is a completely different sector.
Yes,
Uh,
ma'am.
and diagnostic industry is a completely different sector. There are various costs involved when you run a hospital, when you run a diagnostic company. I'll give you a very, very simple breakup of COVID. Supreme Court said 4,500 is the rate what you can charge, because during those times when COVID hit India, there was not even a single kit available of Make in India. All the kits had to be imported. We were completely dependent on imports. We all know that airports had shut down. There was no way of communication. Also, molecular labs were handful of them. So only what was available. Government had never imagined. Nobody had imagined something like this will come and hit the world. So there were various things which added up to the cost. Also, experts in the field were very less. So whichever experts were available, they took this as an opportunity. Then their salaries, also then the ground staff. Now I'll tell you that I had staff whose family was very scared that my child is working in the COVID field. So we had to incentivize them. There is consumable cost which people really ignored. When my technician came to your house, he had to wear a fresh PPE kit. He had to make sure he wears gloves. He was masked, all these. And after he walked out of your house, he had to dispose that. So there is a cost to it, which people don't understand. People think कि क्या टेस्ट का एक जगह पे इतना है, दूसरी जगह पे इतना है, ये लूट रहे हैं. It is not about looting. Second very important thing is your charges also depend on the quality you deliver. Krishna has always been a differentiated player, so I cannot compare myself with any other peers or any other diagnostic service players, because our chairman and we had envisaged this in our hearts that we have to get healthcare, specifically diagnostics, at extremely affordable prices. This is the reason why Krishna was born. And hence we have our own dynamics. It's not that we are not earning, but we have done a reverse calculation. We have our own dynamics. We are India's largest service provider, so we have a better chance to negotiate with our vendors. So there are multiple things which are involved. So when you use the word greed, it becomes like you are humiliating a profession, which is, if all the doctors, let me give you an example. If all the doctors had and their families had decided, no, you are risking your life, hum kaam nahi karenge.
Right.
Would we be able to win this kind of fight? We are.
It's impossible.
So everyone in a profession, you are a teacher. If you start telling that, no, I'm not going to teach my students. So what will the students do? So your students will not say, अरे हमारे सर तो बहुत greedy हो गए हैं और वो पैसों के लालच में सिखा नहीं रहे हैं. The same goes with the doctors also. They have their families, they have their lives, they are available at you at any hour of the day, night. They don't see the clock. So we need to respect them, and we need to understand there is a lot of minute cost involved in running a hospital, in running a diagnostic industry, and all cannot be published and all cannot be publicized to common people because they really don't know what it is.
True.
So generic medicine is one simple example. A generic tablet can cost you 10 rupees and the same tablet can cost you 100 rupees. Today, when you have a fever, what name comes first to your mind? Crocin. Okay, there is a generic combination of crocin, but people will not take that because नहीं उसका असर नहीं होता है. Same is with healthcare. There are doctors available. सारे doctors है. There are BAMS, BHMS. But अगर आपके दिल में दर्द है तो आप cardiologist के पास ही जाओगे ना. cannot go to some normal doctor to show or get your angioplasty done. You are in a good way. And I remember and recall one incident where, it said that, a mechanic charged some amount for repairing the bike, and a doctor charged 10 times more to do a angioplasty. And when it was asked, so the doctor just gave one simple answer: you repair the bike when it is non-operating and it is in a closed condition. I repair a human being when he's still breathing. So that's the kind of integrity and that's the kind of complications we have when we run a healthcare industry. And today, if my diagnostic goes wrong, your entire treatment will go wrong and you're taking your life. So we need to realize that it is a very noble profession. And for handful of doctors who are overcharging, we cannot tag the industry as...
Industry, completely. Absolutely, madam. I'm in absolute agreement to each and every word you have given in this answer.
Thank you.
Madam, the next question is about the enterprise, Krishna Diagnostics. My student want to know the journey. How did you grow to such a huge size and still growing?
Yeah. So one is, as I said, that if you have a great vision, if you know what you're doing is right, and you're happy and you do go to bed with a satisfaction, then then you're on the right track. So Krishna started in December. I mean, we incorporated Krishna in 2010. We started our operations from 2011. We started with 2 mere diagnostic centers in Maharashtra. Our chairman, who is actual visionary behind starting Krishna, had a background of pharmacy industry. He had 14 pharmacy stores. He always wanted to do something different. The real pinpoint what he saw while doing pharmacy in different hospitals was when he saw that diagnostic rates were so high that common man, it was not affordable to a common man. He always gives an example that if anybody has to undergo a knee replacement, or if there is a trauma, and if he has to get a treatment, he had to do a CT scan, couple of blood tests, then his treatment was planned, then post-treatment again, whether the surgery has happened good, the wound has been healed properly inside, get the test done again. So a huge chunk goes into a diagnostic, and the rates were all very high. One incident where he saw was, a woman had to sell her entire belongings to save the child's life. That had really hit him hard, and he said, we have to do something in this sector. So we started with 2 centers in Maharashtra where, we did a lot of research. We took refurb machines to understand the business. There's when in 2011, we finalized that going forward, Krishna will not have a single refurb machine. We will invest only and only in high quality diagnostic equipments so that our services are available, which are extremely high quality. The real turning point in Krishna's journey was when we won the first PPP model in Himachal Pradesh. So Himachal Pradesh government had come up with a tender to install 12 CT scans. We won the tender. We were relatively very new. And when we really went to Himachal Pradesh, I mean, I have visited Himachal Pradesh during those days. The roads were, it's an extremely difficult geographical terrain. For a distance of 40 kilometers, it used to take anywhere between 4 to 5 hours. Sometimes if there was a landslide, if there was ice fall, that same 4 hours journey used to go to 8 hours, 10 hours. My staff who was in the installation, they have stuck in a bus for 13 hours also.
My goodness.
Again, a lot of places in Himachal come under the heritage property. So taking the equipment to that location, we had to use human sledges to take the equipments. But one thing what we got satisfied was when people came to the centers and they literally did a felicitation program for a technician that thank you, you got the CT scan machine for us. Because because they stay on mountains and because there were accidents, if they have to do a simple CT scan, they had to travel 8 to 10 hours. So one fracture would convert into multiple fractures. Yes. So they never used to go in for it. So we, instead of getting people to our centers, we took the center to the people. That was one change we made. And there's we realized that quality healthcare in rural India is extremely needed. There's where we decided that going forward, PPP will be our journey, and then we never looked back. So then followed with Tamil Nadu. Every PPP project has given us a new learning because there are different geographies, there are different cultures, there are different people we interact with. Every state in our country is united yet has a
Very different.
diversity. So that is the reason it kept us growing. It made sure. Then in 2015, a new vertical was added in Krasna's portfolio, and that was Tele Radiology, which I was mentioning. We all know, like, you have people on your platform from Punjab, you have people in your platform from MP and various other places.
Yes.
So if I say Punjab, then Chandigarh or maybe Amritsar, Jalandhar, these are tier 1 cities kind of thing. But there are very small places where are rural health centers where there were x-rays, but there was nobody to report the x-ray because doctors, radiologists were not available. In Himachal Pradesh, there are places where we have a CT scan where there is 3 to 4 months ice fall in a year. Radiologist was not available. So CT scan used to be done and report used to be done after 4 or 5 days when the radiologist used to hop, skip and jump hospitals every day once in a week. So we connected all these centers to our teleradiology platform. We are India's first teleradiology service provider where we've got NABH accreditation to our hub. I would take an opportunity to invite you all, whoever are in Pune, to please visit our hub, which will give you a broader picture, where 190 radiologists are connected through our cloud platform. So whichever part of the country X-ray, a CT scan or an MRI is done, it comes to our hub in Pune. We have a team of about 150 professionals sitting here in the hub. They have their duty hours. They check, there's a first check done at the hub level. Then as per the cases, as per the doctor's duty roster, these cases are sent to the doctor. He is a radiologist qualified. He sees the case, he reports it, and the report is sent to the location. What we have added in technology with Krasna is, with the teleradiology hub, we have added a telecalling center. So there are cases where, you know, we are present in very sensitive regions. We are present in Kargil, we are present in Jammu. So there are bullet injuries. So immediate surgery is required. So if there are such cases, our software signals us that it's an emergency. So our radiologist immediately through telecalling calls the doctor there and asks him to start the surgery, tells him, guides him the point, and till that time he gives the report. So we've been able to save lives because our reports have gone in as less as 15 minutes. So this kind of technology we got. So that gave us a very different stand where we could reach out to very to high multiple locations. So teleradiology was one vertical which we started with super specialty pathology test, because in government hospital basic pathology was done, but states did not have super specialty tests. So all these samples were flown out of the state. So with Krasna coming in, we started that vertical. During COVID, we were the only company who started giving our services from May, wherein our peers started in March, but we did more than 1 million plus tests, and served the people. In Maharashtra, I don't think there might be a single village where a report has not gone. Governments where we have already tied up, they looked at us as a healthy partner, and we got a call from various states like Jammu. Mission head called up and asked that, Pallavi ji, we need your help because we are struggling. We don't have. So we had a chartered flight from where Srinagar, Jammu samples were flown into Pune. Tests were done and reports were given within 24 hours. Same thing from Bhopal, from Indore, samples came into us and we reported them. We started a lab in Guwahati. We started a lab in Coimbatore. We could only do that because we had an amazing team. And we had a confidence that we will be able to deliver that. The first COVID-19 testing bus was launched in the entire, I am proud to say that it was the first bus in the world where, the bus went to the most infected areas. We got an X-ray done. We could isolate people. So we've always thought out of box how we can get technology and easy services. So RT-PCR would cost anywhere between 4,000, but an X-ray would cost only 200. So we were saving those kits, because we were doing larger X-rays and only people with symptoms, we were isolating them and getting their RT-PCR test. Now things have changed, but in the initial days, it was a challenge which we accepted and we delivered it. Today, we are present in 14 states and round about 2,000 plus locations. And our aim and vision is obviously to reach maximum people and to serve the citizens of our country, to ensure we give back to the society we belong to. And I'm sure you might have recently read about Krasna, that we got publicly listed on 16th August. And we are extremely happy that people trusted us. And that's the reason our IPO was oversubscribed by 64%, which is the first IPO in the radiology sector. And this all is possible only because the entire team has come together and ensured that they work on the vision given to them, that we belong to a society, and there is a lot of untouched. India has a population which is almost 65 to 70%, which falls under middle and lower middle class. There is a huge BPL sector which really needs a hand holding. And here's when we came to give them the support, yet doing a good revenue also.
Absolutely fantastic, madam. What a story! What a journey. Due to time constraint, I'll take this as a last question, and it is, madam, what is the way forward for Krasna Diagnostics?
There is a lot of opportunity we see. As I mentioned, there are a lot of verticals we are looking at. A lot of states are now, Government of India is taken a lot of steps now to ensure that healthcare infrastructure is strengthened, and that's why PPP is a way going forward. So there's no looking back at it. Definitely, we had investors in the company who took a partial exit in this IPO, and there are now investors who have trusted us and invested through the public platform, and we are answerable to them. We owe them a lot of give back, and it is our responsibility that we work towards the cause and ensure that the trust they have shown in us, specifically not only investors but the people who are showing trust in Krasna. We always were a very, very covered up name. Nobody knew about it until COVID. COVID is where, people came to know such a company exists in the country and has been giving services to so many people. So the kind of trust, because I feel extremely happy when I get calls from bureaucrats, I get calls from the topmost people saying that humko report aapse hi karwana hai, because till today we have made one thing sure is that we've never compromised on quality. When the government started slashing down rates, people started using different kind of kits, but I feel extremely proud to tell that Krasna is the only company. Till date, we have not compromised on the kits. We still do 3 gene testing. We are the first one to start giving reports with graphs. We are the first one to start giving reports with CT values. We've always ensured that with quality, we use technology and we give comfort to the people who come to us. So that is one thing. So all our labs are NABL accredited. So we ensure that there is quality. We ensure that, there is a kind of trust which we want to build, and we want people that how when I told a couple of minutes back that when you have a fever or headache, you say Krasna. So whenever you need test, you say Crocin. So whenever you need test, you should always say Krasna. So that's the kind of vision we are looking forward to.
Excellent, madam. We are completely with you in this endeavor, and the institute would like to support in every possible manner. With this, I would like to bring the session to conclusion. On behalf of IIEBM, members of staff and student, we congratulate you for successful IPO. We salute you for the affordability, for the remote location support that you are giving to the citizens of this country, and we wish that you grow in business and trust. Thank you so much, and have a wonderful day ahead, madam.
I also thank you on behalf of the entire Krasna team for giving me an opportunity to interact to the young minds and young leaders of our country. It has been an extremely delightful session, and I hope I have been able to inspire someone, or I've been able to give some kind of vision to the young minds.
Certainly, madam, you have given them food for thought. Thank you
Yeah.
so much for your time.
Thank you so much. Have a great
Thank
day.
you.